Okay, so then in 2014, during the American not the American Academy, ASCRS, there was a clinical survey when the doctors, the surgeons were asked which are their impressions regarding ocular surface disease and dry eyes before cataract surgeries. And then the replies showed that less than 20% of cataract surgery patients have ocular surface disease, according to the surgeons. However, another study, it calls FACO study, showed a bit different number. So it shows that more than 60% of patients, in fact, they have ocular surface disease before the cataract surgery. In conclusion, there is a surgeon's underestimation and missing opportunities to improve outcomes by treating ocular surface disease. Sorry, now I just realized this was my second lecture of the day. I think you put the wrong one. Sorry about that. So can you put the lifestyle one?
Could you want to do the after this?
I'm going to speak 2 lectures today.
Okay.
So the subject of this lecture is for the end of the day. Now is lifestyle.
What's your second lecture? The title?
This was the second lecture.
Is it similar? Both?
No.
This one is about environmental and lifestyle influences in OSD.
Yes,
and
lifestyle. This was not the lifestyle.
And what are you speaking the second one?
Yeah, this is the correct
this is one. Okay,
yes.
please go
Sorry
on.
about that. So later on, I continue the previous one. So now this is the correct one. I'm going to talk about environmental and lifestyle influences on ocular surface disease. So an optical total power is about 60 diopters. 2/3 of it, 40 diopters, is derived from cornea. And in the cornea, the tear film is the most critical refractive interface. So the greatest change in the refractive index occurs between air and the tear film. So definitely environment and lifestyle play a role in ocular surface. For the ones who practice here in Dubai, you perceived already that I have several patients with ocular surface disease, specifically dry eyes. And this perception, it's indeed what's really is happening. So just in Dubai, we have an average, and this study shows a prevalence of more than 60% of patients coming to our office with dry eyes. The same in Saudi Arabia, Jordanian, and this is a quite different number from China, Spain, and USA. So why this happens? So here in Dubai, we have humid air. So humidity is around almost 60%. The annual temperature is quite high as well. During the hottest month, the temperature can achieve around 41 Celsius average. And the study shows us that, in fact, dry eye disease is much more prevalent in low temperatures or extreme temperatures, but mostly low temperatures and low humidity. So what's happening in Dubai? That we have high humidity and a warm temperature, which is different from medical literature that shows us that dry eye disease happens in the opposite environment. It's because not just the environment factor that plays a role. Definitely climate related, like temperature, humidity, wind speed, altitude plays a role in dry eyes. But the fact that here in Dubai we have dry eyes, it's because of the outdoor and indoor pollution. So people, they are too long exposed to air conditioning because we are in a desert area. There are also lots of particles suspended in the air. Our lifestyle too long in front of screen, and some other factors that like airborne pollutants. So the effects of air pollutant in meteorological condition also plays a role. These are the most common. And how this affects our eyes, these pollutants, through necroptose or autophagia of the cells, the ocular surface cells, inflammatory response, and oxidative distress. So the meteorological conditions also plays a role, but here we found out that the temperature is warm and we don't have wind speed, not even high altitude. But we know that these atmospheric pollutants in a hot environment like Dubai and with high humidity, both together plays a role for us to have more patients having dry eye disease, because one exacerbates the other. So the Typhus DOS2 epidemiological report shows us that the highest prevalence rates is in Southeast Asia, exception for Singapore. And this is very important to note because there is a confusion. Is this the disease more prevalent there because in Asia because of our, is a confounding factor of the Asian race, is genetics? So then it was supposed for Singapore, if it was just genetics and race in Singapore, to follow the same pattern like Southeast Asia. And in fact, they don't. Maybe because of humidity, there is no desert there, less pollution, but definitely we need more research supporting this hypothesis. And which are the mechanisms of weather that affects of our ocular surface? So low humidity place brings increase of tear evaporation, high tear osmolarity high tear osmolarity as a consequence, and epithelial damage. Talking about wind and dust, mechanical irritation, inflammation, lipid lake disruption, extreme of temperatures alter the meibomian gland dysfunction, gives meibomian gland dysfunction and tear stability, oxidative distress and ocular surface inflammation from UV exposition, and our AC all the time lowers the indoor humidity and reduce our blink rate, activating the whole cascade of inflammation because of ocular surface damage. So, which are our clinical and preventative strategies? We have to take environmental history in dry eyes assessment. So we have to inquire this to our patients. Besides our drops, our oral medication in some case, we have to think about the environment and recommending humidifiers, sometimes eyewear protection, and orientations regarding air conditioning. For instance, in my patients, some patients, they drive long distance, and I always ask while they are driving if they see from the car is directly in their eyes. This definitely plays a role. So we have to encourage screen breaks and increase blink rate. Consider the seasonal adjustments. Some patients, they are quite stable along the year, but along the hottest weathers here in Dubai, they imbalance. We need to consider this, and we need to adjust the treatment of the patient according to the weather. And we need to educate this patient on protective behavior. We need to educate them that in some situations they are going to imbalance because of the environment, because of the weather. Yeah, that's it. Thank you.
Thank you, Sandra, so much.